All right, welcome to Phlebotomy Solutions PowerPoint presentations on latex allergies. Now, if you work in the healthcare field, your chances of developing an allergy are higher. The signs and symptoms of latex allergies may be similar to those of occupational asthma, a lung disease caused by inhaling workplace substances. OSHA, the Occupational Safety and Health Administration, estimates that 8 to 12% of healthcare workers are latex sensitive. Now, workers in plants that produce natural rubber latex or that manufacture products containing natural rubber latex might also be at greater risk. Now, the FDA estimates that 1 to 6% of the general population may also be sensitive to natural rubber latex, which we're going to talk about in an upcoming slide. So again, let's get into latex allergies. Now, is latex free really latex free? Really, it's not. Now, the FDA has been working for the last few years to remove off of most medical product boxes that have latex free to have that removed. Now, the reason for this recommendation is that the agency is not aware of any tests, that's referring to the FDA, that can show a product that contains no natural rubber latex proteins that can cause allergic reactions. Without a way to verify that a product is completely free of these proteins, a claim that it is latex free is scientifically inaccurate and may be misleading. Now, the only other alternatives is using vinyl gloves. Now, this is to ensure that the patient or even the worker does not develop or could have a reaction to using latex or even latex-free gloves that still have the protein. So we use vinyl gloves to assure that there's no reaction to the other gloves that we could possibly be using and causing a medical issue. So again, use vinyl gloves if you have a reason to suspect that the patient could have could be allergic to specific types of rubber gloves or even latex-free labeled gloves that might not be the case. And even for yourself, if you start to develop a reaction to the gloves that you wear, use vinyl gloves until you get into a position where you are no longer reacting to the other rubber or latex-free gloves. Now, are latex-free gloves really latex-free? No, not necessarily. The natural rubber latex is made from a plant source such as a sap of the Brazilian rubber tree. It is used in numerous medical products including adhesive bandages, condoms, medical gloves, catheters, sanitary napkins, you name it. Exposure can result in sensitivity to natural rubber latex proteins, with symptoms ranging from skin disease, rash, hives, or even itching to difficult breathing and wheezing. Rarely shock, and even death can occur in some cases. So again, latex-free does not guarantee that there's not the protein or the specific type of protein that can still cause a reaction when exposed to the skin. So be very careful with the latex-free, and this is why the FDA has been working for a few years trying to get the boxes to remove latex free, because typically there is very little evidence to show that is the case when you look at how the natural rubber latex is made. Now, what about tourniquets? There are tourniquets that are labeled as latex free, and as again we discussed earlier, that is not the case. It's still a natural rubber latex that contains that same protein. So what we do have to do is create a barrier. Wrap a cloth around the arm before using your tourniquet when drawing blood. This will create a barrier between the tourniquet and the patient's skin for contact. And again, if you can't create one with a cloth, use a sleeve. If they have long enough sleeves, bring them down to the mid of the bicep, remember 3 to 4 inches above the site. Wrap the tourniquet around the cloth or the shirt that he's wearing and create that barrier so there's no contact. Again, we want to avoid any kind of reaction if we suspect the patient could be allergic to latex. And again, even latex free, which contains a natural rubber latex. So we want to create that barrier, use a shirt or a cloth, and let's make sure that we have safety on the patient first. Also, very, very important, caution. Make sure you wash your hands thoroughly before interacting with your patient. This is the number one rule before you touch a patient, handle a patient, or even your equipment. Make sure you wash your hands thoroughly before and after you handle the patient. So in conclusion, what have we learned? Well, one, if you work in the healthcare field, your chances of developing an allergy are higher, according to OSHA. Number two, latex free. The reason for this to remove latex-free recommendation is that the agency, the FDA, is not aware of any tests that can show a product contains no natural rubber latex proteins that can cause allergic reactions. Without a way to verify that a product is completely free of these proteins, a claim that it is latex-free is scientifically inaccurate and may be misleading. And number 3, natural rubber latex is made from plant sources such as the sap of the Brazilian rubber tree. Exposure can result in sensitivity to natural rubber latex proteins. Thank you for watching this PowerPoint presentation brought to you by phlebotomysolutions.org on latex allergies.